Yeah, good morning here. This is Emilio Pushman from Brazil. A pleasure to be with you guys. We have a question here specifically addressing children. Do children with comorbidities such as asthma and heart disease have the same or less risk than the adult population with comorbidities in your opinion?
Actually, I want to say that firstly, we no pediatric patients were admitted to our hospital, to our ICU. And secondly, we just have some published data here. And I think relatively few cases were seen among children. And children only account for like only 2% of overall infected population, and 97% of the pediatric cases were asymptomatic cases or mild cases. So relatively, children are more likely to be mild cases instead of severe cases. So to answer your question, the answer will be the overall severity of the illness that the children get is much less than the adults.
Yeah, I agree. I believe pediatric patients are less susceptible to this virus. However, we still need to protect them well, since they might be able to spread the disease inside the family. Something from my part is I have a friend who is a doctor here in Wuhan. His parents got infected or into the stage of critical illness. His son is 5 years old. They live together with their parents, but the son is clean. The child did not get it. Also, as Dr. Gore said, from published data, we believe the young patients are kids who get the disease are less likely to be critical or severe, which is a good part, I believe. But the protection of this group of patients or people are also very important.
So I'm worried that the children are the vector in the family that causes infection, because in the United States, we're not testing the children, and that's what I'm worried about, is the children are the vector.
Although I do not have solid evidence, but I do not think children is the primary vectors in transmitting the disease, because here in China, every single educational institutions is closed since the Spring Festival. That was the end of January. So almost all the children are staying at home since then. So the children are not socially active, and I don't think they are going to transmit the virus to others, to the family members. Actually, I think the parents, rather than the children, are the primary vector infecting the family clusters, because the parents have to go to work, they have to keep social, and their immune system is relatively good. So that the parents are more likely to be asymptomatic, and therefore they might transmit the virus to the elder generation or the younger generation.
Yeah, I agree. The situation here in China right now has entered a later stage, or the late stage of the outbreak. We are focusing on two groups of patients. The first one, the imported cases, which you might have read from the journalists' reports. The second is the asymptomatic carrier or asymptomatic infected patients. just as I said not long ago, I believe we should take precaution to everyone. Every one of them can get the disease. The virus is generally very treacherous and undiscriminating. So the kids can get it, can spread it, although the disease is fortunately to be mild generally in this group, but they should not, run away from the surveillance or the social distancing. We should generally treat everyone samely in the prevention of this disease.